I'm a practitioner here at LifeWorks Wellness Center. I administer the acupuncture and herbal medicine. What I practice is traditional Chinese medicine, which encompasses a wide variety of treatment therapies to treat common diseases. What I offer here at LifeWorks Wellness Center is a complete array of treatments such as acupuncture, herbal medicine, medical massage, moxibustion, cupping, and also dietary recommendations based on the Chinese philosophy of life. To give you a brief overview of Chinese medicine, just to let you know that the Chinese have been practicing this form of medicine for over 5,000 years in written history. Chinese medicine is used all over the world as the major form of medical treatment, whereas the Western medicine is the secondary treatment. Chinese medicine is looked upon as the way in which to treat the common ailments such as the common cold, gastrointestinal problems, menstrual pains, female problems, pregnancies, and such, rather than some of the traditional medicines that we're used to here in the States. Western medicine is used more for traumatology or emergentology, for things as broken bones or head trauma, organ failure such as heart attacks, kidney failure, and the like. The way in which we treat each individual person based on a unique set of circumstances. For instance, people who live in the north have different symptoms and ailments than people who live in the south. We'll take a common ailment like diabetes, for instance. Somebody who comes from a hot tropical climate as opposed to somebody who comes from a cool and arid climate will actually have different types of symptoms associated with their diabetes. So it's this questioning or inquiry in which we find out exactly how to treat that particular person based on what their disease pattern is. Chinese medicine focuses on how we as humans adapt to our local environments. So things like local foods, local atmospheres are big players in disease progresses. We also use palpation in our practice. We palpate several things. We'll not only palpate somewhere on the body where somebody says, hey, I have a pain here in my shoulder, or I have a pain here in my back. We also palpate the pulse, whereas we are not concerned about the beats per minute. We are more concerned about how the pulse's quality is in the body. Some people will have a pulse that feels like a big drum knocking, whereas another person will feel like it's almost a thread tapping. And each one is that is the relative state of the energetics of the blood, how the blood is flowing through the vessel. So based on that, you could take your own pulse and say, my pulse is very weak, therefore my circulation is poor, or wow, my pulse is very, very fast and very, very large, so maybe I have too much circulation. And we also use observation. Observation is probably one of the biggest skills in which we use to diagnose a patient. The same way that you would diagnose a tree, for instance. When you have a plant in your house, you can notice ever slight changes in a plant, and you can tell what that plant needs. For instance, if the tips of the leaves are yellowing, or the bark is flaking, or the soil is dry, you can relatively tell what that plant needs. It needs more sunlight, it needs less water, it needs less sunlight, for instance. The same goes true with the human body. Different colors in people's faces, the way in which they hold themselves, the strength of their voice, the manners in which they look at you or say things. All of these are very important diagnostic features because your organs are constantly speaking. They're just a language that we don't recognize. In Chinese medicine, we are taught to look at those different features and use those as diagnostic benchmarks to be able to treat different kinds of diseases. And lastly, another very important thing is the inquiry process is the actual body fluids. Sweating, urine, bowel movements, thirst, hunger. All of these are our natural instinctive body procedures, and these will tell us a lot of they have a lot of diagnostic merit in order to treat your different disease. So once we diagnose you and find out what the problem actually is, we will use several methods methods to treat. We don't always use acupuncture. Acupuncture is probably the most recognized form of traditional Chinese medicine that is practiced here in the United States, using fine needles to insert in some of the different acupuncture points like I have here on these charts. And they are specific points that have an abundance of nerve and blood receptors or blood vessels in the area to send a chemical message to the brain to get the brain to change the way that the body responds to certain ailments. We do needleless acupuncture as well. I have several devices that we can use. There are lasers. Lasers resonate at the same frequency of blood, so they're able to quicken the blood and help to circulate the energy. We use electric stimulators. This particular stimulator here works with biofeedback, so I have to hold somebody's arm in order to make a connection. But then once the connection is made, you're able to turn the machine on, find an acupuncture point, treat an acupuncture point using electric stimulation to be able to stimulate the brain and the blood to be able to do those same types of things. Another very common method of treatment here that I use is auricular medicine,